Okay. Well, let us resubstantiate a couple things that were stated for keeping the drinking age at 21. There was an article by Stephanie Ehler from the University of Arkansas talking about students studying abroad and what they do when they go to an environment, an international environment where the drinking age is lower. Students, she says, students who are under the age of 21 who study abroad almost triple their drinking habits while studying abroad, according to a study done by the University of Washington. This is most likely because Americans aren't exposed, like our opponent said, they aren't exposed to the legal lower drinking ages. So when they are exposed to it, they go crazy. They triple their drinking habits. This is a problem, and why we shouldn't lower the drinking age to 18. She continues on. My observation is that students do take advantage of the lower drinking age. And then finally she states that while many underage students drink in the United States, the University of Washington found that those who increased their drinking levels abroad, while they were studying abroad, if they increased their drinking over there, their excessive drinking continued when they returned home. So if we lower the drinking age to 18, students from 18 to 20, or people, young adults from 18 to 20, are going to increase their drinking. They're going to be exposed to it as they are abroad because the drinking ages are lower. They're exposed to a younger age. They're allowed to drink. If the drinking age is allowed here, they're going to be exposed to it. They're going to be drinking. Their habits are going to increase. All the issues of costs that are associated with that, all the drunk driving fatalities, the pregnancies, the theft, all the bad things that go along with that because they're not responsible because of the age of maturity, all those things are just going to escalate and increase. Continuing with what my partner stated about the age shift from now underage drinking is 18 to 20. If it's lower to 18, the age shift, underage drinking is going to go to 15 to 17 or even lower possibly. Between 2004, and this is a study done by the U.S. Department of Health and Human Services, between 2004 and 2009, the level of emergency room visits from underage drinkers remained constant during those 5 years for both 12 to 17-year-olds and 18 to 20-year-olds. So they're already drinking, and if it's lowered, they're just going to drink more because, like my partner said, now that's the new forbidden fruit. It's just closer for them. And finally, let's look at a couple of the health effects that were previously described, the effects on the brain, how it's not fully developed. Scott Swartzwelder, a PhD from Duke, said that alcohol causes sedative effects and relieves anxiety, among other things. In teens, there is less of a sedative effect, and that is dangerous and misleading to teens. We know that alcohol consumption can impact learning and memory in the adolescent brain with the development of it because it's not fully developed. And continuing with those health effects, the brain system from Scott, the PhD from Duke, the brain systems that give drinkers positive feelings may adapt to the alcohol and come to need it. After repeated use, the brain systems come to feel that something is missing when alcohol is denied. This motivates people to drink even more. Eventually, people drink to prevent the negative effects they feel from not drinking. In underage drinking at 18 because drinking at age 18 because the brain isn't fully developed yet increases the risk of alcohol dependency. And as underage drinkers continue to drink and continue to grow, those are some of the health effects on the brain.